Okay, so this one is a real short one, really just making it so one, that I follow along with the course notes, and two, so that we can talk about the differences between viral encephalitis and bacterial encephalitis. So once again, I've talked about a lot of viruses before this, CMV for one, which definitely can cause encephalitis, but I'm not going to talk about it necessarily in this module. You had videos for that we talked about earlier, and there's some on the YouTube page that you can kind of find as need be. So this is more of an overview of what viral encephalitis is. Okay, so remember, we're talking about aseptic at this point, right? Because septic refers largely to bacterial meningitis or encephalitis. It's typically a little bit less fulminant than bacterial meningitis, which is good because we don't really have many treatments for aseptic encephalitis or meningitis. So usually we're able to just provide supportive care until patients have completed recovery. The symptoms can be almost identical to bacterial meningitis. Early on, you'll get that headache and the nuchal rigidity. If the patient has encephalitis, the headache and the nuchal rigidity are still there, but so is this altered state of consciousness. And anything from like mild lethargy to coma is possible. And obviously, if a patient is in a coma, this is not something that they are just taken care of at home. They're coming in and you'll be providing supportive therapy to them there. We can also see kind of these neural deficits or neurologic deficits or seizures, depending on which part of the brain is affected. In HSV, for instance, we see a lot of kind of like bizarre behavior, hallucinations, etc. And that's largely due to the fact that HSV kind of likes the temporal lobe. So because of the behaviors that are associated with that part of the brain, we tend to see kind of this odder behavior. So a massive behavior change in the patient. CSF profile. So this is going to be different than bacterial meningitis. So with bacterial meningitis, remember, we were looking for a lot of polymorphonuclear cells, a decrease in glucose, and an increase in protein. In this case, we're still going to see an influx of cells into the CSF. But what we're going to see this time is lymphocytes, right? And that makes sense. Think about the immune response. When we think about the immune response, you want PMNs for your bacterial infections, and you want CD8s and CD4s for your viral infections. So, and maybe some NKs, because those are pretty helpful. So lymphocytes, those are going to be our big recruited cell, which is helpful. You're going to see maybe a mild to moderate elevation in protein, but the glucose is likely to be normal. So that's kind of a difference in the CSF profile that you're reading compared to bacterial meningitis. Pathogenesis. This is a virus. Most of the time, it's going to come in through the bloodstream. So we're talking about viremia. The cell targets are typically neurons or oligodendroglia. And because of that, remember, when it's a virus, you can kind of get buildup of viral proteins within the cell, and that leads to inclusion bodies. So you might see intranuclear or intracytoplasmic inclusion bodies depending on the virus that we're talking about. Supportive care here is the key. We typically don't have that many specific treatments that are going to be able to help out a patient should they have something more specific. If we look at this microscopically, you're going to see kind of a similar reiteration of what's happening here. You're going to see a lot of involvement in the brain parenchyma. And you might see some perivascular lymphocytic infiltrate, microglial nodules, neuronophagia. That's more associated with like a chronic encephalitis, like you might see in like HIV. So you might see those things as well as you're kind of thinking about how this might look under the microscope. So for more information about the encephalitides that are caused by viruses, I'm going to make a couple videos on the ones that we're covering here, but that doesn't mean that that's all of them. So like CMV, like I talked about, that one can definitely cause encephalitis. And some of the other organisms too.